At 8 a.m. as I count down the top 10 Texas Red Dirt songs that are packing the dance floor. I'll be featuring local artists and the story behind the hits, shows in the area, as well as new songs that make you want to dance. It's Dance Time in Texas with DJ Mike on Lone Star Community Radio, 104.5 KCZW and 106.1 KZCC, Conroe, Texas, or online, irlonestar.com.
Thank you for listening to Lone Star Community Radio. This program was broadcasted and recorded live from the LSCR studios in downtown Conroe, Texas. Lone Star Community Radio is supported by listeners like you. Donate and sponsor today. For more information on getting involved with Lone Star Community Radio, contact us at lscrstudios@gmail.com or visit us online at www.irlonestar.com.
There, the Veterans Hour, your source for news, talk, and uncensored commentary here on Lone Star Community Radio. You can catch new episodes the first Tuesday of every month at 1 p.m. on Conroe's very own FM 104.5 and 106.1, if I remember those numbers correctly. You can find us on Facebook, Facebook Live, YouTube, SoundCloud, and wherever you get your fine podcasts. The title of today's show is September Suicide Prevention Month, because we're in September and it's Suicide Prevention Month, and we need to, as a veteran community, I could sit here and I can read off all these stats that you probably know, but I think we're going to do something a little bit different today. We have in the studio with us a licensed professional counselor, my daughter, I'm very proud of, Allison Burrell. She has her own practice in Lubbock, Texas, and so I wouldn't put her on restriction. She cleared her calendar so she can come in for the next hour and talk to us. And let me read, as we always do, some bona fides on our guest, and then I'll have her introduce herself. Allison C.R. Burrell, M.A., M.Ed., LPC, and she'll tell us what all those things mean. Allison is a licensed professional counselor based in Texas. She's a graduate of Texas Tech University, get your guns up, with master's degrees in language and culture and clinical mental health counseling. I want you to remember those words. Allison provides telehealth services using linguistic and eclectic counseling techniques to assist with many mental health conditions. Allison focuses on sexual health concerns, autism, and intellectual and development disabilities. When not providing mental health, Allison can be found practicing in the local theater, art shows, and activism in women's issues. Yes, I raised a liberal. Allison, welcome to the show.
Thank you for having me.
Welcome to Conroe.
Thank you.
So, I read your bio. What else should we know about you?
Well, we've been lucky enough to study at Texas Tech University, which is one of the top schools in the country for clinical mental health counseling. We are only beat by Northwestern in our test scores, so we're very proud to boast that, and we've had some amazing professors that we've gotten to study with. We're one of the leading training programs for trauma, which I think is very important for your listeners right now, because most of your listeners have undergone quite a deal of trauma. So a lot of your Texas-based therapists, and especially therapy in general, if you were seeing an LBC, do a lot of trauma focus right now. That's the thing. So it's a great time for resources for veterans with counseling.
Let me ask you a personal question.
Sure.
You look very young.
Yes.
But then I'm the daddy, so you're, always... How old are you?
I'm 34.
And how long have you been doing this?
I have been in the field for 15 years. I've been counseling specifically for 5, and I have been in independent practice for a year.
So you have some experience in this.
I do.
Now, Alice and I were having a discussion before the show on suicide, because just in the past 2 weeks, I've personally dealt with individuals who were suicidal. And we tend to agree on this. When you hear he wants to kill himself, he's thinking about suicide, and all these other euphemisms for it, suicide at its most core is really, really simple. And I disdain the phrase, it's a call for help. No, it's not a call for help. Suicide breaks down into two classes. One, I want to do it. And two, I'm going to do it. And you know what? If they're successful, they're no longer here. It's not a cry for help. It's a cry for, I can't do it myself. Because all of the little things, because nobody wakes up in the morning and says, I'm going to commit suicide. It's all these little things that pile on and pile on and pile on to the individual feels like he's in a dark box and there is no way out. That's when suicide becomes a serious matter. Nobody wakes up and says, I hate my life, I'm going to commit suicide. No. And you have to understand that all these little things that may mean nothing to me, you, and the postman, to this individual, they're life-altering events. Is it PTSD? Is it trauma? Is it anxiety? Is it depression? It's a whole host of things. And as a society, we tend to lump all of the veterans with a mental health issue as PTSD. Now, Allison, if PTSD is not the underlying cause, seeking counseling specifically for PTSD, is that going to help?
Not specifically, no.
So it's important that you get the proper diagnosis.
Yes, immensely important.
Why?
Suicidal ideation, which is essentially that first thing that you're discussing, that first half you're discussing, it's I'm thinking about suicide, can be caused by a number of different conditions. Trauma-based disorders and mood-based disorders are your two biggest.
You're going to have to define what each one of those are.
Happy to do that. So mood-based disorder, this is something you're hearing about a lot now, more and more, of depression, anxiety, and bipolar disorders, for example. Now, this is a very basic thing. So this is the depression being having no desire to do anything. It's not like just sadness, which is where people tend to get the confusion. It's a complete lack of desire. Anxiety is like constant fear based on really nothing. And bipolar disorders are conducted by extreme bouts of high energy. And I don't mean like, oh, I can do everything in a day. I mean, you're not sleeping and you are building this tower by yourself. And then depression afterwards. And now there's more varieties to that and more nuances, but these are typically caused by some hormonal issues or different like brain chemical issues can also be factors here, as well as diet, exercise. A lot of things can trigger mood disorders. They are pervasive, but they're very treatable disorders if you get the right diagnosis for them, because the treatments for all three are different, medication-wise and therapeutically. You have different techniques depending on what you have. Trauma-based disorders, PTSD is the common one we hear for veterans, post-traumatic stress disorder, as I'm sure all your listeners know. Not always combat-related. You can get post-traumatic stress disorder from any traumatic event, and is usually a result of what is called acute stress disorder. Acute stress disorder is a traumatic event happens to you and you start having flashbacks and you can't function. That's a treatable, very treatable condition. If it's left untreated, that's what turns into PTSD. Also takes...
Something that you might not know about veterans, though you grew up with a veteran family and, you know, your grandfather and your uncle and whatnot. Did you know that veterans as a whole can't be late for anything?
You have to hurry up and wait.
Yes. We get very anxious if we're going to be late for something.
Yes. Yep, this does not surprise me.
That's a symptom. That's not a disorder.
Yes, yes. Now, you can have all kinds of symptoms of things and not have a disorder. One of my best examples for this is if you look at all the personality disorders, we all have symptoms of some personality disorders, but it doesn't make it a disorder. For something to become a disorder, it has to affect your life in a negative way. If it starts impairing your ability to hold a job, if it starts impairing your ability to maintain relationships with other people, if it starts affecting your physical health, this is when we really consider this is a disorder.
Now, a licensed professional counselor.
Yes,
You specialize in certain things.
I do.
So that would make me think that there's other LPCs out there that specializes in different things.
Yes.
That one LPC is not equal to another LPC.
Yes.
Is that because your trainings differ?
Our trainings all start the same. So if you get brand new, fresh baby LPC right out of university, they're all going to have the same, we all have the same basic training. We can all train and treat the same disorders. Really, so can a psychologist. Marriage and family therapists also have the same similar trainings as well. What happens is, just as everybody else, we all have our own interests, hobbies, things that fascinate us the most. Because of the nature of our job, we are continually learning. We have to do continuing education. And people will then get further training in their specific interest areas.
Oh, so a mental health professional is like a doctor.
Yes.
We have general PCs, we have audiologists, we have podiatrists, we have butt doctors.
Yeah, we do.
And so you wouldn't go to see a butt doctor because you have acne.
Absolutely.
So you wouldn't see somebody specializing in one thing
Yeah.
when you actually have another thing.
And now you absolutely can, and you can get decent treatment, but you will get better treatment from people who specialize in what you are seeking out. So you might go and see my colleague Keegan Trussell, based in Waxahachie, who does mostly.
It's pronounced Burger King.
She focuses mostly on veterans issues, specifically men's veterans issues. That's her focus.
My God, we got clients for her.
Oh, I will plug her number, I guess. She also focuses on death anxiety, which works really well with a lot of these same issues. She's like, that's the best one to go to. But I have another colleague who, Kathleen Pendleton, who focuses very heavily on substance use issues. That's her skill set. That's her interest area. So if you're struggling to get sober, that's the person you want to see because that's her skill. That's what she knows the most of.
I am going to convene in the coming months, or whenever you get back, a blue ribbon panel with you and your colleagues.
Oh yeah, we'd love to.
I was on a call just recently, just today as a matter of fact, with an individual, and they know they need help. They want help.
Yes.
But there's still the stigmata. Is that the right word?
Stigma.
Stigma of oh my God, I'm seeing a mental health counselor.
Oh yeah.
Look, guys and girls, men and women, boys of all ages. You've known me now, this is, our 7th year, 8th year we're going on this, Dick? You know me by now. I suffer from Mary Poppins syndrome. I'm practically perfect in every way. I have received an improper diagnosis of narcissistic tendencies disorder, but we know that that's not true. Now, if I can live with this, if I can seek help, so should everybody else. There is no reason on God's green earth that you should be embarrassed. I'm going to fall back on our military training because I'm talking to military guys and gals out there. Did you ever go it alone? No. You always had a buddy. For me, I was lucky. My beloved 10th Mountain. We had a battle buddy. You've all heard Brother Johnny on the show before. That's my battle buddy. We were never alone. I got your six. That's just not a catchy phrase. I got your six, brother. We call each other brother. We call each other sister because we mean it. If you reach out, help's going to find you. And there's no weakness in this. I never, ever, 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 ever again want to bury a veteran due to suicide. There's no need for that. You can't solve your problems by yourself. You never had to solve your problems by yourself. You always had a battle buddy. Hopefully, you had a great chain of command like I did. And you can run up the chain of command until somebody got you the help that you needed. It works the same. The worst place you can be is inside your mind. You stay inside your mind too long, and you're going to go cuckoo. And having a mental illness or a disorder is not being crazy, not being cuckoo, not being insane. Crazy is a bad word, not being insane. I have a veteran very close and dear to me. And I tell this veteran all the time, you're not insane. You're crazy, but you're not insane. It's probably that person going, what are you talking about me now for? I forgot that. Guys, by the way, you can text me in studio on our Google phone, 936-344-3083. And if it's not vulgar, I will read your text on air. So if you have questions, by all means, please text them in. So we have a veteran, and this may be you. You may be married. Maybe you're not. Maybe you're in a committed relationship. Maybe you're not. Maybe you have kids. Maybe you're not. If you remember back in May, we had another specialist on here, a psychologist, works with veterans, very well known, produced a book, and we talked specifically about support groups for families and teens. She wrote some great books. I read them. Yes, I can read.
I wasn't going to say anything.
It didn't have any pop-up pictures in it.
It's so disappointing.
It was. When you are living with somebody that has an undiagnosed and untreated disorder, whether it be bipolar, whether it be mood, whether it be whatnot, if you're living with that person, how does that affect both you as the individual and those that you love?
You know, I've worked with people on both sides of these situations, and I'd like to say to anyone who is currently experiencing suicidal ideation or maybe currently planning, I promise you that when they find you, when they learn about it, it's crushing your friends and family so much more than you believe it is. A common theme that happens when people are experiencing suicidal ideation is that this would be better for everyone, especially for the people that they love. And it never is. It never, ever is. Those people who love you suffer so much more than you ever think they are. Watching your loved ones suffer has brought more clients to me than people who have had suicidal ideations on their own.
So, let's give a hypothetical situation. You're living with somebody, and you feel that this person may be suicidal. How do you know?
The best thing to do is to be direct and ask directly. There's been a lot of research on this, and the research shows that when people are planning suicide, they're going to be honest about it. So now this is not the same case if you're working or if you're talking to somebody with an intellectual or developmental disability. This is a little bit different. The technique is different. But given that we're talking about generally neurotypical people, any of your veterans, asking the question directly, are you thinking about suicide? all the studies show there will be an honest answer, yes or no. Now, if it's no, you can drop it. Or you can say, okay, I felt worried. If that changes, like, please know you can trust me. If the answer is yes, then there's sort of the duty to do this next thing. Now, you can get a training on this called Question, Persuade, Respond. Most universities will give this training for free. You can look up QPR. Free trainings are available. So if you get the answer of yes, then I'm thinking about suicide, the next thing I like to suggest is, thank them for trusting you. That's a big thing. It's hard for anybody to admit. The next part is to ask if there's a plan. Do you have a plan? Now, if they don't have a plan, okay, great. That's a really, we're still in a really good treatment space. We're not getting to crisis. Thinking about suicidal ideations is a common symptom among many, many conditions. So it's if you're thinking about it, so are millions of other people today. And it's definitely helpable through cognitive behavior therapy that can be assisted with. The next part is, asking if your person has a plan, to go through and be like, okay, let's remove the means.
What do you mean, remove the means?
Some of the most common plans to commit suicide are, for men, more violent means, so driving off of traffic or using a gun. Females tend to use less likely to be lethal means, such as poisoning themselves. So responding with what the means is and ask, okay, well, can I remove that for you? If the answer is, I want to drive my car off a bridge, all right, I understand. Can I take your keys and can I be your chauffeur until you get into your therapist? I want to shoot myself. Thanks for trusting me. Can I hold your guns till you see your therapist? Setting up a plan like, okay, at this date, if once you do this thing, I'll return your keys to you. I'll return your guns to you, whatever the case is. The willingness to do that shows also the willingness to change the plan, to seek out help before committing the plan. They may say no. They just may say, no, I'm not going to do that. I'm not going to give you my keys. Then the follow-up answer is, okay, do you know when? When are you going to do this plan? And once you have the when, you can be sure, say like, well, I plan to do it next Tuesday. I'm going to have all my bills paid off, whatever the case is. And we can talk a little bit more about the signs. There are also more signs to know if it's impending. But that means, okay, well, you know what? I guess who's not going to be alone on Tuesday? It's you.
Now, there's resources out there.
Yes.
We've touched on this before. You don't know what resource to go and seek unless you know what's wrong.
Yes.
And if you're in crisis, I'm going to do it. I got a plan. I got a timetable. And like I said, nobody wakes up in the morning and says, I'm going to go off myself today. Especially if you're a veteran. I mean, you have your battle plan, and then you have your backup plan for when the battle plan fails when you first get to the enemy. Yeah, that's just the way we're wired. How does a person know what to go seek? How do they know what's wrong with themselves? I get calls from veterans that I'm in the PTSD program and it's not helping me. It may not be helping you because you may not have the right diagnosis. How do they know what's wrong with them? All they know is there's something wrong.
Yeah. Go to your professionals. The best thing to do is to find a professional that you trust. It's not uncommon that people do self-diagnosis. We've always done that. I've always been a big WebMD girl. The amount of times that I have had liver cancer is overwhelming.
Your mother has banned us from WebMD.
Yes,
just so you know.
We're not allowed. But the thing is, and then now that we also have TikTok, and people are, going on TikTok talking about their autism ADHD, or that they have complex PTSD, or they have they have borderline personality disorder, all these things. Now everybody believes that they can diagnose themselves. Now, while you are an expert in your own self, keep in mind that, you don't have the training, and we, or professionals, know what to look for. Go online, go to Psychology Today, look up therapists in the area, and read the profiles. If you read them and you're like, oh, this person's boring, or this person sounds like a jerk, or whatever the case is, don't call that person. Nearly every client I have says that they came to me because they read my profile and felt like they could get along with me. And that's why they chose me. The biggest indicator of therapeutic success is a good rapport. So go through, read the profiles, pick someone who seems like they're a good personality fit for you. If your first 2 sessions they're not, don't stay. Get a different therapist. Pick someone else.
You can do that?
You can absolutely do that. We are all prepared for that. We all understand. You can tell your therapist, hey, we're not a good match. I'm going to keep looking. And we're like, cool, no problem. Do you want me to send? We will offer you a referral list if you do that. You can ghost us. That's fine. We understand typically when we get ghosted, either maybe we did something wrong or it just wasn't a good fit. That's fine. We'd prefer if you check in so we know that you're not dead. But we can also give you more referrals to other colleagues that we know. But absolutely, change, find, look, interview. You can also interview us. A lot of therapists will give free 15-minute consultations. You can see on the phone if it seems like it's a fit until you find the right person for you who will find your correct diagnosis and will be able to tailor your therapy or your treatment method to your needs.
Say that again.
Well,
the right diagnosis and tailor your therapy to your specific needs.
yes.
Text me on the air. But thank you for calling in. I appreciate that. Please text me and I'll have Allison answer your questions. You know the story of Trevor and the 6th floor at the VA?
Yes.
It was obviously not a good fit for me.
Yes.
Skinny jeans, man bun, and a scraggly beard is probably not going to work for me when I'm up here and you want to get me down here.
Yeah.
Diagnosis is key because suicidal is not the diagnosis. Suicide is the end result of all of these other factors. Is that true?
Yes. Suicide's a symptom. Suicidal ideation is a symptom. It is the end result. There are so many things that happen. You're having other symptoms from whatever else is wrong. Some therapists won't even tell you what your diagnosis is because some therapists believe that it's more harmful because it can be used as a crutch to say, oh, well, I have depression and that's why I can't get out of bed. Depression is why you can't get out of bed. But that's not the excuse because you can get treatment for it. It's the symptom. Once you get, and it's just as very similar, just as you mentioned when we started the show today, is once you get to these suicidal ideations, these suicidal feelings, it's all of these things are like bricks on top of you weighing you down. And there's nothing, you try, you do all these things, and there's nothing left. No one's taking the bricks off, and eventually you're going to succumb to the pressure.
And that's a fault of veterans. As a veteran, I'll sit here and tell you that we will not ask somebody to come take this load,
Yeah.
even for 5 minutes. I am the exception to that rule because I have Brother Johnny. Your Uncle John, you've known him your entire life.
I have.
I will call Johnny and go, I can't take it anymore. And his response is, let me carry that for you a little bit. Let me carry that for you, just for a little while.
Yeah.
Veterans can't do that. So, treating a veteran, in my mind, is different than treating Dick.
Sure.
You have to approach them in a different manner. And sometimes the veteran doesn't know what they're feeling or what they're thinking. if you ever had to exist in my brain for 5 minutes, you'd be like, oh my God, what is wrong with him? I tell this story that I was possessed by a demon once, and the demon said, why is it so dark in here? And I said, yeah. And he said, ow, that hurts. Wait, everything hurts. Yeah, I know. Oh my God, I'm not going to stay here. I'm out of here. Demon, wait. What? Take me with you? Unfortunately, when you get to the point of I'm going to commit suicide because I can't see another way out, of course you can't see another way out. All you can see is the four walls around you, the top and the bottom. You can't realize that somebody can lift that top off and lift you out. That's why you have to seek out help. And I encourage every single person at the sound of my voice, if you're thinking about this, sometimes you just need a voice in the dark. 936-344-3083. I'm not going to sit here and tell you I'm going to answer that 724. I may be in the bathroom and you don't want me to answer it. Keep calling. I will answer it eventually. There is a distinction between suicide prevention and suicide intervention.
Yes.
Can you tell me what those are?
Suicide prevention is when we're still in that first stage of ideation. We're having the thoughts. And like I had mentioned before, the thoughts are not uncommon, and they can be going anywhere from fleeting, such as like you're driving down and you drive over a bridge and you think to yourself, oh, I could just turn the wheel. That's a fleeting suicidal ideation. Not a plan, just a thought. And then it can go to very distressing, to where you look at your car keys and that's all you can think about is going in and driving off that bridge. And it's constant and it just distresses you. This is kind of the range of severity that we're looking at. All of this is treatable. Cognitive behavior therapy is the technique that most therapists are going to use for that. And what that is, it's where we go in and we look at how your thoughts are influencing your behaviors. The idea is, and I think a lot of your veterans in the veteran community will like this, we don't pure cognitive behavior therapy, you don't necessarily need to know the past and rehash all of the trauma that you've gone through. What we just need to do...
We call that scab picking.
Yeah. What we need to do is just look at the behavior. If the behavior is constantly, I am wanting to, like I'm doing things that are putting myself in danger, well, okay, so what's the thought? The thought is, I'm worthless. All right, so we're going to tackle that thought, give evidence to where you do have value, and because we're doing it that way, we're going to then change the behavior. Once we change the thought, that behavior is less likely to happen.
And this happens within a week, right? 10 days?
No. So with your really basic type of issues, if we're really like goal-oriented, there's a solution-focused therapy, which is designed to take 10 sessions. And this is very much for like, okay, I want to learn how to be more organized. When we're looking at something that's more pervasive and essentially deadly like this can take months of treatment. And now remember, especially with cognitive behavior therapy, our behaviors are things that we have learned throughout our entire life. So if you're coming in to session and you're 30 years old, right? You're a 30-year-old veteran and you have learned and taught yourself that you are worthless and therefore you do things because that are dangerous to yourself because you feel that you are a worthless person. I am not going to be able to teach you something different. We're not going to unlearn that behavior in an hour, which is essentially what your one session is going to be. Even if you're coming to me every single day, we're not going to unlearn 30 years of behavior in 7 hours. It takes a lot of work, and it takes work outside of your sessions. You can't just come in, talk to your therapist, and go home, and then in a month you're cured. You're going to have to do the work on your own as well. You have to take what you learn in your sessions and put it into practice in your day-to-day life in order to unlearn 30, 40, 50, 90 years of behavior in order to start relieving some of that pain and some of the struggles that you're experiencing.
You just said something that a word, and that word was cure.
No, yeah.
So mental illness can be cured, like the cold.
It's not curable. Now we can make arguments that there are cures to things. That technically, let's say you can cure a phobia. I mean, you can.
No, you can't. Spiders. Spiders are evil. If you see a spider, kill it. If you try to kill it and it runs away, it is logical to burn down the house after that. I'm here to tell you that. Don't listen to anybody else.
Mental health issues are all treatable. You're never going to feel absolutely 100% perfect, because also we are human, we are flawed by nature, this happens. But things can be treatable. If you have depression, if you have a phobia, whatever the thing is, you can treat it and learn to be able to cope with these things. You can build skills so that you are not suffering on your day-to-day life. Let's say you have an anxiety disorder, and if you have panic attacks every time you go into HEB, we can treat that. So you may still not like HEB, but you can go and do your grocery shopping.
Let me ask you an off-the-wall question.
Hit me.
So, you're diagnosed with a anxiety disorder.
Sure.
Does that mean you're having panic attacks?
No, not
You're
necessarily.
having anxiety attacks?
Not necessarily, no. It can be a symptom. You may have anxiety or panic attacks. That can be a symptom of them. But another common anxiety disorder is agoraphobia, for example. This is fear of public places, and fear of wide open spaces. You don't necessarily have a panic attack because you're not going outside. You're staying inside all the time. This is still disordered because it's disrupting your life, but that doesn't necessarily mean you have a panic attack because you're not doing the thing.
Did you all hear that? Just want to make sure you're paying attention. Because I know some of you out there. All right? That's why I asked her.
If you are actively avoiding any, a particular place or situation, and you are not, you aren't willing to say why. You're just like, I absolutely will not go to HEB. It's never going to happen. I'm not going. I won't do it. Someone pulls into the parking lot of HEB and you're like, cool, I'll wait right here in this hot parking lot. We might be looking at an anxiety disorder. What is it about HEB that's keeping you from going there? You're not having a panic attack, but it is unusual that you won't go to that specific place. Does that make sense?
That makes sense. So, mental health disorders, syndromes, whatever you want to call them, is very nuanced.
Mm-hmm.
And there's not one diagnosis that fits everybody.
Oh, absolutely.
You may have anxiety and she may have anxiety, but they're totally different anxieties.
Yes. Yeah. All of these will present differently for different people. These things can change among genders and can definitely change among cultures. One of the biggest things that you've mentioned is treating veterans in a different way than you treat everyone else. This is the same as just cross-cultural awareness. Veterans are a specific cultural group, just as Hispanic Americans are a specific cultural group. Jewish Americans, a specific cultural group. And all of these things require specific training, which is one of the things that LPC psychologists all receive when they're getting their training in school, are specific cultural trainings. So you can also rest assured that your therapist has at least had a semester of training. Granted, one semester this is why we have specialists, right? Has had training on how to treat veterans specifically because it's recognized as a specific cultural difference.
Now, you're sitting pretty in this because you have masters in language and culture and a master's here.
Yes.
So you kind of stack the deck in your favor.
Yes.
I don't know where I was going with that.
Just complimenting me.
Of course, because you're so beautiful. It makes me have to ask, so I've sought out a mental health professional and seeking counseling, and I'm with a therapist. when do I know that I need a psychiatrist, that I have to have my head shrunk?
So psychiatrist will be a medical doctor. They're the ones to prescribe your medication. Now, your therapist can make medication recommendations to your psychiatrist, depending on the psychiatrist you choose. They typically are willing to work as a treatment team. So you would sign a information release. They'd work together, discuss your diagnoses to make sure that you get the best treatment possible. If you are only seeing a therapist, they will typically tell you if they recommend you consider medication. Sometimes if you are at a point of so much severity, so typically if you're at the point where you're making a plan already, your therapist will likely recommend, okay, let's talk about getting you with a psychiatrist, let's get on medication. Because therapy is great, but it can only go so far if you are not able to take on that information.
Oh, so let me get this straight. Because the VA's answer to everything is another pill.
Yeah.
So what I heard you say was that we need medication and counseling, not either or.
You need both.
I need both.
Now think about it. When you break your leg, right? You have to have sometimes surgery or a cast and pain medication, calcium supplements to repair your leg. But once your leg is repaired, it's no longer broken. You don't just go on living your life regularly, right? You have to go to physical therapy. It's the same concept, only we can do these things at the same time. So while you're on medication, you're going to therapy. And we have and it's a full-on little treatment method that will help you to gain coping skills and feel better.
So if you give me a medication, a psychiatrist gives me a medication,
Yes.
and I'm taking this medication, and it just totally foobars me. I'm just sitting in the Barca lounger drooling. Is that the best that I can expect?
No, please. If your medication isn't working, if you're zombied out, if you don't like the way it feels, tell your psychiatrist immediately. You can call them that day and be like, "Hey, this is bad. This isn't working. Here's what I'm experiencing." There will be something different. Not every medication works for every person. Most common one is SSRIs. There's a general line battle plan, if you will, and plan Bs for different medications. You're going to start with the front line and hey, okay, so that one didn't work. Okay, that's not a problem. Here's the next one. Let's try this one until we find the right one that works for you.
And the right dosage.
And the right dosage.
Are you familiar with the mind-altering drug Wellbutrin?
I am very familiar.
And that's a psychotic drug, right?
It's an SSRI.
What's an SSRI?
It's a serotonin reuptake inhibitor. It is the most common type of antidepressant that we use right now.
So it is a psychotic.
It is a psychotropic medication.
So, back before I had my neck surgery, I had to quit smoking.
Yes.
And I went to the doctor, and he put me on Wellbutrin. And I went, I'm not depressed. So, do you need to communicate with your mental health professional all the medications that you're taking?
Yes, please do, because also
I'm taking high blood pressure pills. What does that matter?
It matters immensely because different medications will interact with your different medications that you take. So SSRIs are great, but if you've already been put on a different medication that might increase dopamine, you would need a lower dose of an SSRI, for example. Different medications all have different interactions. And also I'd like to add, if you use alcohol or any kind of illicit substance, or not even illicit, if you smoke Delta 8 or take Delta 8 gummies, make sure that you tell your medical professionals that, not just your psychiatrist, but also your medical doctors. Because psychosis could, for example, if you take Delta 8 and a certain blood pressure medication, you're more likely to experience psychosis. And who would hate that?
I'm going to tell my good listeners out there, Wellbutrin is a wonderful drug for smoking cessation.
It is.
It's really good. But for me, it gave me very, very vivid dreams, not just in Technicolor, but vivid dreams that I'd wake up and I'd be really upset with my wife because she divorced me in the dream. And you know, it took me a couple of hours to realize that's just the dream. Because you know it in one side of your brain, but your other side of your brain can't reconcile that.
Yeah.
So just like you can have different reactions to different medications, Ozempic, for example, you may have a different reaction to that depending on what else you're taking.
Yes.
Just because something isn't working for you doesn't mean that you should stop your treatment plan. What it does mean is that you need to communicate.
Absolutely. And you may find, for example, let's say you're on Wellbutrin and you find that you're also having vivid dreams. Maybe they're nightmares. Trazodone's really common. Trazodone is a great...
Trazodone to mess you up.
It's great for a lot of people, but some people get horrific nightmares with trazodone. This may be a side effect that you're willing to deal with if it helps your other symptoms well enough. Great. Maybe it's not. So maybe that means you need a different medication to tackle the nightmares, for example, or maybe to switch completely. But your medical professionals will know what that is, but not if you don't communicate what's going on.
Troops, prepare to shoot, move, and communicate. Communication here is key. You didn't go into battle not knowing the battle plan. What makes you think that your mental health is anything different than that? You don't go it alone, and we have professionals to assist you. So, write this down. Write this down, people. If you are in crisis, if you're step 1 suicidal or step 2 suicidal, guess what? You are in crisis. If you are in crisis, I want you to dial 988 and press option 1. I recently did it. Wonderful people. But they can't help you if you don't communicate what's going on. Because the person that answers that 988 call, it's just another person that's trying to figure out from you where he needs to call so you can talk to somebody. In my case, it was a good 45-minute conversation with him last week before he said, okay, I know the person you need to talk to. I'm going to transfer you to Christina. Can she call you right back? Wonderful call. If you are in crisis, call 988 option 1. If you call me and I think that you're in crisis, and trust me, I don't know anything that my daughter knows. I'm just the voice on the radio. But if I think you're in crisis, I'm going to call 988 option 1 and get you where you need to be. I will do that. I also want you to reach out to the Suicide Resource Coordinator at DeBakey. His number is 713-794-7002. Why would you call him? You'd call him because you've decided that you can't do it alone and you need somebody, not just a voice in the dark. I need to sit down with somebody and tell somebody what's going on so they can not only hear my voice, but read my body language. I need to see someone. That is your Suicide Resource Coordinator, 713-794-7002. 3 minutes? Now, pay attention. The title is Suicide Resource Coordinator. It doesn't mean that you have to be trying to commit suicide to call them. That's just their title, okay? Also, you can call DeBakey ER. 713-791-1414 and ask for mental health. You go into the ER. You can go in as a walk-in, or you can call ahead. It's a lot faster. Call ahead. Call this number, 713-791-1414, and ask for mental health. There are professionals that will come get you out of the ER waiting room and take you back to be evaluated, because that's the starting point, isn't it?
It's a starting point. Just talk to someone to figure out what's going on. And there is no shame in it, really. And every professional is going to normalize this as much as possible, because you are not the first one to go through this. You will certainly not be the last.
And for the love of God, people, if you've gotten to the point where you need to make these calls and you're afraid to make those calls, who should you be calling? 936-344-3083. Doug, I'm afraid to call these. I'm going to tease you about being afraid, of course, but I'm going to call for you. Allison, only have a couple of minutes left. Oh, I wanted to mention two things. First, Reverend Jim Russell. You've heard me talk about him before. He is doing a suicide intervention training at VFW 4709 this month. Please call the post and figure out when and go to his course. It's fantastic. The second is the VFW, as usual, we'll be doing the 9/11 Veterans Remembrance Program. I am the guest speaker, of course, so come on down September 11th, 6 o'clock to the canteen. Listen to me mouth off about why 9/11 has changed my life. Allison, I want to thank you for coming in and talking to my listeners.
Thank you for having me.
Do want your resources for your colleagues.
Absolutely.
But ask them, can I make those public?
Yes.
Because if they're specializing in veterans, here's the problem we have in Texas. There's more veterans than there are resources.
Yes.
And even if your colleague can't help them directly, they may know of a resource that they can reach out to.
100%. And the easiest thing to do is search veterans, therapists, and then your area. Psychology Today will pop up. That's the fastest, easiest way to look at a list of therapists who are currently accepting clients. And you can go through, read those profiles, interview therapists, find the right fit for you.
There is help out there, especially for veterans. I don't want any of you to ever feel that you're alone, because you are not. I want to thank you for listening. If you have any questions, drop me an email as usual, douglasb@veteransair.us. And I guess that wraps it up for this month. We'll do something in October, probably something for Halloween, do a contest or whatnot. So tune back in. Until then, I'm going to leave you with the song by the Warrior Song Project. And while we're listening to it, let's remember our brothers and sisters that are today standing in harm's way for our liberties and our freedoms. If you're wearing the uniform, I want to say to you that I'm proud of you. I want to say to you, thank you. And until next month, stay safe and stay vigilant.
With a need to bleed you when the light goes green. Best believe I'm in the zone to be. From a yin to my yang to Z. Put a grin on my chin when you come to me. Cause I'll win, I'm a one of a kind. And I'll bring death to the place you're about to be. Another river of blood running under my feet. Forged in a fire lit long ago. Stand next to me, you'll never stand alone. I'm last to leave, but the first to go. Lord, make me dead before you make me old. I feed on the fear of the devil inside of the enemy faces in my sight. Aim with a hand, shoot with a mind, kill with a heart like Arctic ice.
I am a soldier and I'm marching on.
shoot the bastard.